Here at the Melanin Initiative, we simplify medical information into language you can understand. We create safe spaces for you to ask your questions and share our nursing perspective. Today, we'll be speaking with our special guest, Dr. DeLeon Addison, a doctorally prepared nurse educator and academic leader. She's deeply committed to improving nursing education through innovative strategies, and she brings a wealth of experience in faculty development, curriculum design, and student success. She is the founder of Addison Academics, where she leads workshops and boot camps aimed at preparing the next generation of nursing educators. We're in for a treat. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative Podcast, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand it, and then to use it to manage your health and advocate for others. We have two missions here. The first, to promote health literacy, both for the public and our peers. The second is to elevate the expertise of nurses, to bring awareness to all the diverse career opportunities in healthcare, and then to share with our peers all the ways that they can leverage their expertise as clinicians and entrepreneurs. If you haven't already, this is your time to subscribe, leave a thumbs up, leave a comment, share this information. Every time you interact with our content like that, whether it's on a video or audio, it shows the algorithm that this information is important, so that when people like you look for topics like this, will show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are opinions alone. They are not a representation of any of our affiliations. If you think you might be having a medical emergency, you should seek medical attention from your medical provider. If you think you might be having a physical emergency, you can call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741-741. Family and friends, stop what you're doing and listen up, because today we have a true change maker joining our conversation. You know we're selective about our guests. We bring visionaries who are transforming their fields. And today, we've invited someone who's revolutionizing nursing education from the inside out. This brilliant leader doesn't just teach, she architects the future of nursing, molding tomorrow's healthcare professionals with intention, innovation, and heart. As department chair of nursing at Dallas College and adjunct faculty at Tarleton State University, she's not just participating in academic leadership, she's redefining it. Her approach to curriculum development, student achievement, and elevating nursing education breaks traditional boundaries and creates new pathways for excellence. Her credentials speak volumes: a doctor of nursing practice, a master's in nursing education, and a bachelor's in psychology, combining clinical expertise with a deep understanding of human elements essential to nursing care. Beyond her degrees, she's earned recognition as a certified nurse educator. She serves as a peer evaluator for the Accreditation Commission for Education in Nursing and stands at the forefront of professional organizations, including the American Nurses Association. Whether you're currently in nursing, passionate about education, or someone who values the transformative power of mentorship, prepare for an enlightening conversation that will challenge and inspire all of us. Turn up your volume, lean in, and join me in welcoming the remarkable Dr. DeLeon Addison to the Melanin Initiative Podcast.
Hello, Dr. Madison. Thank you for having me today.
Isn't she beautiful? She's wearing one of my favorite colors, yellow.
Hey, one of my sorority colors as well. I'm a member of Pi Eta Phi nursing sorority. Our colors are yellow and green.
And both of us are joining you from the great country of Texas.
Yes. And it's warm, a beautiful day today. Nice after all the bad weather, right?
Yeah. And so before we get into our conversation, we want you to play a little icebreaker with us. It's called 5 Questions in 5 Minutes.
Okay.
The first one is, what's the best thing that never happened to you?
Best thing that never happened to me, Bali. I want to go to Bali.
But it hasn't happened to you.
Has not.
But you want it to happen.
I absolutely want to go.
Okay, so this is something that didn't happen that you wanted, right? Like a friend of ours, she had a job, she got fired. At the time, that seemed like a bad thing. But in the long run, the best thing that never happened to her was staying there, because it allowed her freedom to build her business.
Gotcha. Okay, so let me try this again. Best thing that never happened to me was actually being able to move back to Illinois, where I'm originally from. So I had moved to Texas, come down here, had some things happen and thought about going back home. Wasn't able to do that. But I've had so many opportunities here in Texas that I probably would not have had. I know I wouldn't have had I moved back, including my first job as a full-time faculty member at Tarrant County College. So I'm grateful for the opportunities I've had having stayed here.
Wonderful. There, she got it, guys. The next question: what's the next big thing you want to be a part of?
Next big thing I want to be a part of, I want to be a nursing expert in a book. So, already considered a nursing expert, but the first time you get referred to in a book as a nursing expert, like, that's what I look forward to. Like,
Okay, are you working on that?
I am. I've had several articles that I've published. And so I've gotten mentioned from that standpoint, articles that I've written. For example, last year I was able to write for Bridges, the Addison journal, talking about how my faculty and I prepare regularly so that we can stay ready for accreditation visits. And so that was one example of something I've written and someone's referred to, but like textbooks that nursing students get, all those books we had to read in order to get these degrees. When you're mentioned in one of those, I look forward to that as far as the nurse educator track of education.
Well, you just put it out there. We look forward to seeing that. What's one of the most important things you've learned about communication?
The most important thing about communication is listening, because I think so many times we can misinterpret body language, or how we perceive it is based on our context as opposed to truly listening to what the person is trying to convey to us, because we've got a preconceived idea.
And then I'm going to switch this one up. What's your favorite sunscreen?
Wow. Most of the time, I think we go with banana, the banana boat one. But, probably because I have a kid, so that's the first one that comes to my mind.
That's fine. And then the last one, what season are you in?
I am in my me season, taking care of me, figuring out what self care and what future me is. I've spent so much of my younger years dedicating them to going to school, and taking care of my daughter. She is getting ready to start high school. So what does me look like without school or taking care of others?
Have you gotten an answer?
More free time and more of my money in my pocket.
Right. I think we're all trying to get there. Thank you so much for playing our icebreaker. Let's learn more about you and what brings you to the show. So, if you can, tell us your background and what inspired you to enter the field of nursing.
So I've been in nursing a little bit over 20 years, and I guess I should say healthcare as a whole. I started off as a patient sitter in the hospital, became a tech, a nurse. And then when I went back to work on my doctorate, I actually was working on my NP classes at the same time. So I've also been a provider. And so that was fun as well. Even though I decided my passion is nursing education, I still have had that opportunity to prescribe and diagnose and things like that. So always have that as an option. I also have my master's in nursing informatics as well.
Oh, wonderful.
Uh, that is my background as far as education. What inspired me? I love to take care of people, and I've been around nursing since I was a kid. My mom's a nurse, and one of the things that stands out to me the most in her compassion of patients was there was a point where she worked in home health care. And this was before the time of HIPAA and things like that. But I remember my dad going with her to take care of this family. The family had a child that was disabled, and they needed a ramp built at their house. And my dad and a couple of his buddies, they went over and they were able to build this ramp for this family. And it just shows like nursing isn't always just about the med that we give or the diagnostics or any of that. It's about our compassion. People need the love and care that we give as nurses, along with our knowledge of the body and medication and medicine. They need our care and our compassion. And it's something that nurses we bring that's a little bit different from others in our healthcare field.
I agree. And when did your nursing career evolve into academics?
So when I was in undergrad, I had a teacher that told me that I wasn't going to make it to be a nurse, and that I really didn't have a right to be there. Now, I had always been a high achieving student. I had a scholarship to go to this college, but for whatever reason, this particular faculty felt that this wasn't the place for me. Now, mind you, I also was a double major. So you mentioned I have a degree in psychology. I was a double major in psychology and nursing. I thought I wanted to be a mental health nurse. And I have worked in mental health nursing, although that has not become my specialty or my focus. It is something I've done. But when she said that to me, I was like, how horrible that you would try to break someone's dream as opposed to help them get to it. Now, we all know there are some things that are not for everyone. However, have we tried every avenue? And it's something important. I work currently in a community college, and we have a lot of non-traditional students. And so we have to really look at it from a lens of everyone doesn't learn the same way. And sometimes we need to access not only other ways of teaching or activities, but there may be other barriers in that person's background that are impacting their ability to be successful. And so when this particular instructor said that to me, I knew I wanted to be a faculty member that made a difference, that helped other people achieve their dreams as opposed to crushing them. And so it was then that I knew I was going to go to school to get my master's in nursing education. So I graduated, and within 6 years, I went back to get my master's and was able to start teaching. So,
Do you want to shout out any of your schools?
so I graduated with my master's of nursing education from Gonzaga, and it is actually one of my degrees that I'm most excited about because Gonzaga's on the West Coast. Obviously, everybody knows the Zags and our basketball team is always at the top, right? But going to a school on the West Coast, having lived in the Midwest and then in the South, you really get to understand how so many trends and liberal practices start on the outer edges of our nation and then move in. So there were things that I was exposed to in my master's program that had not become best practices yet in the Midwest or the South. For example, two nurses inserting a Foley. Now that's becoming standard practice. But in 2013, 2012, when I was in school, they were just starting that. They also were doing aromatherapy as part of the healing for patients with pain and things like that in the hospital, acupuncture, things like that. So I got exposed to things that I wouldn't have had I only went to school in the Midwest. And so that is also something I'm proud of. So I did graduate from Rockford University in the Midwest with my undergrad and Bryant Stratton for nursing. And then I went for my doctorate in the South to Troy University in Alabama. And so I feel like having gone to school around the country for each of my degrees allows me to have a very varied thought process, allows me to be a lot more well-rounded and open to new things, ideas, change, because I've had the privilege of being exposed to a lot of different things.
Wonderful. Yeah, a lot of different pedagogies, especially when it comes to education, right? So, speaking of your foundations in nursing and psychology, how has that combination influenced your approach to nursing education?
Well, obviously, teaching in mental health, that actually was the first course that I taught in both adjunct and full time in my first full time nursing job. So it impacted my ability to be able to teach it, evidently, because you have a better perspective of your patients who have mental health diseases. But I think it impacts how I take care of my patients, but then also my ability to see my students and my patients holistically. Sometimes we just look at people as a diagnosis, or we're looking at students as their grades, as opposed to, as I spoke a little bit earlier, the things that make us whole. Like, I can tell you this semester that my grandparent died, my grandfather, who I was very close to, and he was on hospice, and I was flying back and forth from home. I probably wasn't the best instructor that semester because my mind was constantly going like, how do we take care of him? When is this thing that we're all anticipating him passing away going to happen, right? And then I was also a mother at the same time, on top of being a teacher. And so all of those things play an impact on how we're able to show up in our day, right? And then also, even when we don't have those things going on, those life changing things, our context, how we grow up, where we come from makes a difference. So we talked about my mom, right? And my mom's a nurse. Well, my mom's a first generation college student and college graduate, right? And for her family. But her context going into education was different from mine and my brother's because she had gone. And so things and challenges that she encountered were very different from those that we did. And the same with our students that we encounter. They all bring something different to the table that allows them to be successful, or maybe barriers for them to be successful, or maybe they're motivators, right? Because it's not just challenges, it's those things that motivate us, right? Why am I here? What's going to make me show up every day? And that plays back to our psyche and how we behave as humans.
Your grandfather passing, was this semester?
No. I was just giving that as an example. It
Oh,
happened. It's been 3 years now, but I'm just saying that particular semester,
yeah.
I know I didn't show up in my best self or as the best instructor or any of that because it was hard.
Well, thank you for sharing. What's his name?
Luther, he's a Luther. He actually he's Luther Senior. My dad's a junior. My brother's a third, and then he named his son, and we have a fourth.
Oh, so I also have a third. My brother, he's the third. And speaking of family, you did touch a little bit. If we can, we talk about family a lot of times, talk about healthcare, we talk about risk factors and genetics, but we have a lot of nurses who have a legacy of nurses in their family. So if you can just tell us a little bit more about your family, their background when it comes to healthcare, and how that inspired your journey.
So we talked about my mom, and she's the biggest inspiration as far as my family goes in nursing. But I also have an aunt who's a nurse. She works in hospice and med surg. And then my brother is a paramedic and firefighter. So he spends half of his day every day on an ambulance and taking care of patients from that standpoint. And then I would tell you, I have a brother that's in business, but he started off in nursing school. So he went through the end of his sophomore year, and then he was like, "This isn't for me." But he has a very vast understanding of nursing, obviously being surrounded by a sister and brother and a mom who are all in healthcare as well. And we tag our dad in as well, even though he's in engineering. He was a big part of my mom in school because my mom actually went to college and graduated after her and my dad were married. So he was there to help with homework for my mom and me and my brother, obviously, as well. So we do have quite a few healthcare providers within our family as well. We have a surgical tech. So we probably could own our own clinic and run it
That's
just
what
in
I
our
was hearing.
family.
And have the school to prepare everyone, the training.
Right.
So for that one brother, we'd love to have him on the show, the one who's a first responder. And then the other brother, you said he went to nursing school, then business. Well, all of us go to nursing school and business. When we show up for work, we just didn't know that we were in business. We thought we were getting
True.
in healthcare. We didn't realize healthcare was a business. We thought we were getting to nursing, but really we're getting into the business of the healthcare industry. I talk about that all the time. And then you and me, right? Went to nursing school, and now we're in the business world,
Yes.
like, learning how to navigate that. So very interesting. But thank you. Yeah, so many of our guests, myself included, come from a family, a legacy of nurses, and yeah, we just want to bring attention to that.
Yes.
Okay, so let's talk about your transition from clinic to academia some more. You've had significant clinical experience working in settings like step down, hospice, the ER. What was your personal transition like from nursing to becoming full-time faculty? Almost 10 years ago.
Yeah, it actually has been 10 years almost exactly this summer. So I honestly, I don't know that my transition was hard in the sense of mindset because I was ready for it. Like I said, I knew from pretty much like my sophomore year of undergrad that I would be a nurse educator. So I had been preparing myself from that role for that role. I was fortunate enough to work my first adjunct position was while I was in my grad program. And that is where I would say the transition was a little hard, right? So I decided I'm going to teach while I'm in master school so I can be prepared and have an up when it comes to doing interviews. So I actually started off teaching in an MA program, teaching A&P and teaching their Procedure 1 class, which is like basically health assessment for us. Like they learn how to do vital signs, take blood, all that kind of stuff. Well, I was excited to teach and I went in with all the vigor and passion that there was, but there was no one to orient me. It was like, here's your class, here's your syllabus, you have 8 weeks to teach this class. And I gave it a valiant effort. But I look back now with the knowledge that I have and the experience, and I'm like, you were a wreck. And we're fortunate for those students. And not that I didn't do a decent job. I just know now, had I had better training, I could have done a better job. I wasn't assigned a mentor. There was no one who I could shadow and watch them teach the class. It was literally like, here you go. And so let's fast forward to having graduated from my master's. And I was fortunate enough, I got to teach adjunct at my alma mater. Did get a mentor there, but I was adjunct. I got to shadow a little bit. So I got a little bit of experience. But when I became full time faculty, I got a mentor. But when people mentor, a lot of it is here's what I did.
Yeah. Oh God, you're going to trigger me. Yes, go ahead.
It's or here are the PowerPoints I've used. But I think sometimes we don't think about the fact of everybody doesn't know what's the important content to cover.
Yeah.
How do I make a PowerPoint? How do I know what to put on the PowerPoint? How do I know what to test for? Yes, you went to school for nursing education, but theory and application are very different, as we know, having been on the floor, right? We all went to nursing school and we're like, this is how you take care of a patient. But then you get put in the room and you're the only person taking care of the patient. You're like, wait, what was this from school? I need to remember. And it's the same thing with nursing education. Actually, even more so because actually a greater percentage, I don't know the actual percentage, I can tell you the first school that I taught at full time, probably 75% or more of our faculty were clinically prepared masters versus academically prepared, meaning they went to school for nursing education. And so you have that transition of clinician to teaching without ever learning about adult learning theory, teaching and learning strategies, and all of that. And so while I was fortunate enough to have had that because I had a master's in nursing education, you really need the combination of the two. You need someone who is going to treat you like that novice first day nurse as a nurse educator. And we forget that. Like, just like when you transition from working in the ER to now I want to work in pediatrics, but I've been in adult ER. You become a novice nurse again. And it's the same thing with nursing education. And we treat individuals as though because I've been a nurse, that automatically means I can teach. And that is where my passion for creating Addison Academics came from, is as I transitioned into nursing and saw gaps in how I was oriented. And orientation and mentoring is very different. A mentor is like more of a, like when you talked about emotions and things like that, I feel like that's more of the mentor side, right? Like, oh, I need to vent because I had this student that I had this issue with. Versus orienting is, hey, when you're giving this exam, you need to look at your course outcomes. You need to look at your NCLEX test plan. You need to make a blueprint, a test map. It boggles my mind the amount of people who have taught 2, 3, 4 years and are like, no one ever taught me how to do a test map. How can you not? But this isn't a part of orientation at every school for every faculty member coming in. So I'm not going to say I had a bad transition by any means. I was fortunate to not have that, but I definitely saw gaps in mine as well as those who came before or after me, or who maybe had different mentors, because everybody mentors and orients differently. There may be a checklist of things like you need to make sure this person knows, but how are you truly teaching people to teach? And that is a very different concept.
Yeah, you brought up a theme that is prevalent in nursing, is this concept that because I have experience that I'm well positioned to teach and educate. And we see this actually not even just in nursing, because when I was a biology student, I had a lot of tutoring in biology and biomedical engineering, and they were very smart people. Okay, very smart, very bright. But that doesn't make them the best tutor, because a lot of times people in those positions, whether you're tutoring or teaching or even speaking on stage, you have to be well versed, right? Have a lot of tools in your toolbox. And a lot of times people say, "Well, this is the way I learned it. This is the my learning style," and they lean into that as opposed to the person who's receiving the information. If the goal is for the person receiving the information to receive it in the way that they understand, then the focus should be on making sure they can do that and not on continuing to strengthen your strengths. And even I was surprised in the DMP program, back then they called them the DMP Essentials, that they specifically had that section that to teach, you really need to have the pedagogy, which is you do not get just by because you're in a DMP program if it's not specific to education particularly, which took me by surprise, but I totally understand what they're talking about. And so because we see this is so prevalent, because you go to nursing school, you assume that you're going to know everything when you come out because it's called nursing school. So it comes as a surprise that when you do get to the floor, you don't know everything. Then the person who's assigned to you was voluntold. They didn't know they were going to do it. They didn't receive any training to do it. And then that's a reflection on the experience you're about to have. So based on what we know about nursing school, what we know about clinical orientation, what you have just described about transitioning into academia, with that information, based on your experience as the department chair of nursing at Dallas College, what are some solutions for that?
Hi, I'm Alicia from the Melanin Initiative Podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
So I will say, first of all, I don't have the answer. There are definitely things that I'm doing that I think will contribute to that I work with my team to do. But I think the big answer to our problem right now in nursing is going to come when all the parties sit at the table and come up with a solution together. Not just talking about it, but here's a comprehensive plan, and Group A, whose academia is going to do this part. Group B, whose the clinical partners are going to do this part. Group C, who are our accreditation bodies, are going to do this. Group D, who are our licensing partners, are going to do this. And we're going to stay in contact and continue to work through this, especially as we see our preceptors becoming younger and younger, right? So it used to be our preceptors were, according to Benners, a competent nurse, meaning they had 5+ years of experience before they could precept. We have preceptors that are 6 months to a year out of school. So they're still inexperienced novice nurse themselves.
Yeah.
And so, how am I working with my team to address that? Well, first of all, we are constantly training, uh, whether that be on item writing so that we can write efficient tests, or development when it comes to strategies in the classroom, which I think is one of the biggest things that I stress and talk to them about. How are we actually teaching? So, for example, if I'm teaching on hypertension today, I might have lectured, but all of my faculty, and actually in our program, the faculty are asked to have at least one active learning activity in every lecture class, every class period. So, how are we teaching students to apply that information so that they can use it? Because talking at people is one thing, but research shows us that we have to do, read, write, then do. So they read before they came to class, we hope. They write maybe while you're lecturing, and then what do they do? Whether that be working through a case study or some kind of in-class simulation, virtual simulation, so they can learn how to apply and manipulate that information so that they can give patient care. So much of nursing has been observational for a long time. Like, I'm watching someone else do it. We really have to put our students in the seat to give care, to be the nurse. So I'm sure my students probably get tired of me saying when I come by, you have to be the nurse. You have to put yourself in the seat of the nurse. I actually had an opportunity today to visit some of my students in the clinical setting and go with them to see some patients and talk to them about patient care, and utilizing that clinical judgment model that we know the NCSBN has changed to utilize for our licensure tests, asking them those questions and making sure they can answer them. Asking them, are you utilizing this model every patient that you take care of? Do you know what information is relevant from your assessment? Do you know what you can do as the nurse? What interventions are you expecting? What contraindications? So, being the exemplar for my faculty in that way, especially some of them on my campus in particular are novice. So modeling that for them so they can also use those Socrative questioning through using those clinical judgment model as well. And then, like I said, the teaching and learning strategies, making sure they're getting faculty development through training, and then also including the students in that. So regular communication with students about what's working, what's not. Some enrichment sessions, I actually jump in those myself, even though I'm not regular faculty. I'll do some of those enrichment sessions, having one-on-ones with students to say what's working for you. Because students sometimes they're like, Kimberly's reading and she's doing questions. I need to do that. And this student's doing the study guide and I need to do that. And so it goes back to what you were saying, like finding what works for them. And so sometimes when they come to my office, not sometimes, anytime they come to my office, like we talk about, well, what are you doing? And what's too much? Because quality study does not always equal quantity, right? You can be studying for 8 hours, but if it's not quality, then you're not getting much out of it. And so I think all of those things are important. The one-on-ones with students, making sure faculty have the best tools at their disposal so that they can be successful, and then making sure students have the tools as well.
Okay, so you mentioned sitting at the table. That's a common sentence that's said on this show. But look, we know our lives, right? They're very full-time lives. They require 24-hour dedication. We know our practice requires 24 hours of our attention. We know our students require 24 hours. And if you have your own business, that's 24 hours. So it sounds really good, right, Dr. Addison? But how do we make that happen? How do you get people to sit at the table, to have time to prepare for that table, to be involved in that table, and to actively participate, and then carry out whatever solutions are recommended in real life?
Wow.
That's
That's a
their life. That's their
mouthful,
life.
Dr. Madison.
That's our life. Because these students, they're watching this. We're telling them all this stuff. It sounds really good. And then in practice, in real life, we're struggling.
So I'll agree with you with the struggle. I will also say, I tell all of my students They need a calendar, and I obviously live by one as well.
That's an action.
So,
That's something someone can actually do. Like those are words that you have given that someone can do something with. So let's talk about the calendar, right? Should it be digital? Should it be hard copy? What should be in there? How often should they look at it?
so that's going to be dependent on what you like. I used to when I taught in class, I would bring literally a paper copy of the first week, and I would have them sit down and write it all in. I personally like, usually I prefer a written one, but I do have a digital one as well now because it's just more convenient, right? Uh, However, what I tell them is you need to think about everything in your life, like all those things you just said, because sometimes when we're writing down our calendar and we're in school, we write down all of our school assignments, right?
Mhm.
We don't write down that I need to spend an hour putting the kid to bed, an
Yep.
hour cooking dinner. I also work on Mondays and Fridays to support myself because I have to work part time.
Now we're
Okay,
talking.
I have a spouse and we have date night. And even though we can't have the 4 hour date night that we were having prior to me being in school, I need to at least spend 30 minutes to an hour on date night because I don't want to lose my support system, right? And they need attention too. So it's important that they write down all those elements and we talk about that because they'll come to my office or they'll talk to their faculty and they're like, well, I have a calendar. Well, what's on your calendar? Are you following your calendar? When you don't meet the task that you were supposed to, so maybe you're supposed to read chapter 16 a day. If you didn't read chapter 16, what happened? Did it fall off? How do you make sure that you can continue to get through that chapter and get to the next thing that was on your task list? And when it comes to reading and regurgitating is not my thing. I will tell you that was never my thing. And as you know, having a doctorate in nursing, we've done a lot of reading, or at least we were assigned a lot of reading throughout our time in school. And so, one of the biggest things I always tell my students is study guide. Study guide will get you through any chapter in your book if you purchase it. It may seem crazy that you're doing a crossword puzzle or you're having to write down definition, but it's helping you to attain the knowledge in that chapter. And then, if you're not a read and regurgitate person, you've at least had exposure to all the important points, and then you can go back and fill in from your teacher's lecture, listening to videos like osmosis or those content.
U World's real still popular.
I like UWorld,
Now, this
especially for
study
my
guide,
seniors.
are you talking about something specific when it comes to the study guide, something you guys offer, or you just mean in general?
In general, so every nursing textbook has most of the popular ones that we use, like Perry and Potter, Lewis, things like that. They all have a study guide, but they're not always assigned like as an assignment. But for students, if they are not a read and regurgitate person, but even if they are, I think study guide is important because it helps them pull out the main ideas uh, with so much reading. And so they're going to get those initial like uh, highlighted points, right? The most
Mhm.
important part, content. So it is an extra fee, but I guarantee it's worth it. And like I said, sometimes I get students say, oh, this just seems like busy work. But I've had it because I've assigned it for my students sometimes. And I'm like, you got the benefits. You don't understand, but you'll understand later because we're responsible for all that content, whether the teacher tested me on it or not. I'm still responsible as a nurse for that. The biggest example I give for that all the time is like, no matter what school you go to, you were tested off on how to insert a Foley, right? But most schools, and you might have them here and there, aren't testing you off on how to use a bladder scanner, but we all have to use one and use it properly and understand when is it contraindicated, when do I need to use it, what does it mean, how do I, did I do 3 scans or did I do one? you know um, However, I'm still responsible for that information. And it's the same way with the book. You're responsible for all the content whether your teacher tested you on it or not. And one of the biggest fallacies I think we have in nursing with students is that I just need to know what the teacher's testing on. We say that that's not, but students are really focused in on testing.
Yeah.
And the number of faculty who still believe that testing, well, if they can't pass the exams and I don't have 5 exams in my class, they're not going to be ready for NCLEX. Well, they may not be, but if we don't prepare them for practice, they're going to kill somebody. We are teaching people how to be nurses, not to take a test. If we teach them for understanding and for good practice, it doesn't matter what anybody asks them. They're going to be able to answer the question because they understand the disease process and they understand the care and interventions that we should be implementing as nurses.
Yes, you're bringing up some separate shows. Uh, when we talk about study strategy, which is missing, right? Because of that dependence on just tell me what I need to know. And also the busy work. Oh my God, I can't tell you how many students say because the focus so much is on the patient care, not realizing the whole big picture. So when we do these other things, they think that's busy work, taking them away from the only thing that they're responsible for, which is the patient care. But that's not the only thing you're responsible for. But that's another show. You mentioned hypertension. This show was inspired by high blood pressure in a patient I was taking care of who couldn't tell me what high blood pressure was. And from that conversation, I was inspired to start this show. And now I'm on a mission to get all my clinician friends not to use that word when we're talking to the public. And if we really don't use it to anyone, then we won't have to worry about switching. I really just want us to use the word high blood pressure because when we say hypertension, the patient thinks they know what we're talking about. And so the first thing they say is, I don't feel, and then they put in a blank, right? And because they don't feel anything, they don't need to take the medication because they don't have a problem. But I'm hopeful that if they hear the word high blood pressure, maybe they'll say, hey, what's high? And then maybe we can have a conversation. Then next time they come back, they say that they're taking their medication.
That's a hope, right? But you bring up a good point. It's absolutely true. And it speaks also to the importance of having our student nurses understand the importance of patient education and how to do it. The clinical instructor, I told you I went today to evaluate one of my instructors, hang out at the clinical site with them. And that particular instructor was talking about how he had asked the students to do some nursing education. He's like, DeLeon, I don't think they understand it. And so we were talking about strategies to help them so that when they go in the room, they can use layman's terms, right? Language that the patient understands. So they get what's wrong with them and what they need to do so that they can get out of the hospital, stay out of the hospital, and have good health outcomes. That's also a portion of what I did my research for my doctorate on, which was health literacy. And it looked at how educating the patient in their knowledge of their disease process impacted their health outcomes. It all comes back to, did we do a good job, right, of making sure they understand?
Okay, how do you evaluate if we did a good job?
So in my particular in my research project, we used the health literacy scale that we had the patient self identify what they felt was their understanding of literacy. But then we did some correlations between that and what their lab work and their current diagnostics looked like. And so those who scored higher and felt that we had established that they had a good health literacy, their outcomes were better, and vice versa, right? Those who didn't have a high health literacy, their outcomes weren't as good. And sometimes that had to do with the language barrier, and some of it had to do with just understanding their health in general.
So it's a screening tool?
Yes, it was a screening tool.
Is it implemented in practice?
Not holistically. There are some places that use it, but no, not not at all healthcare facilities. But it is a tool that can be found on our national NIH National Institute of Health website. There you go.
And so how can it, based on your expertise, right, you wrote a whole paper on it, how can it be implemented in a busy practice, whether this is acute care, outpatient? What's your tip?
We have them fill out everything else, right? How many times we send out a pre-screening tool?
This is going to be before the visit?
So the health literacy brief is a tool that you could use beforehand to generally understand people's understanding of health, right? And then I think more importantly, even after that, So we do this pre-screening on our patients, and there's two parts to this, right? Did the patient understand? But then how good of a job did the healthcare provider do? And I think we measure that by the understanding of the patient afterwards. And so doing the tool again afterwards, or utilizing the health measurement tools that we learn in school, right? Can you demonstrate back to me? Can you verbalize back to me your understanding about this? And sometimes, due to time, which we've talked about several times today, we don't have time. And so we don't. And you have a new onset diabetic. How many times have you seen them give themselves an injection before they are discharged?
Yeah.
Is one or two times enough? We know that it's not, but a lot of times, you know, if we get one or two times is good, but it's not many more times than that. Do they understand how a scale for giving themselves insulin really works? So
Maybe
those
we can
things.
utilize some of our students who are in clinical rotation. That would be a great opportunity, right? And digital, maybe the digital follow up, making sure it's easy for them to use. Those are some options, perhaps.
Yeah,
Um,
you got Emmy out there, and now we also have telehealth. So maybe, like you said, utilizing some of our interns and residents to, hey, you do the follow up visit to make sure the first time they're home and they're having to look at their insulin. Oh my goodness, the word is escaping me right now. What?
concept?
No, the protocol for giving themselves insulin.
Oh, but I love this topic about the health literacy and evaluating the patient. One thing I've changed in my own practice, which we talk about at the top of the show, our mission, is making sure the patient knows how to use this information when they manage their health at home, because they're only with me for a few minutes. They're with themselves all the other time, so they have to know what I know. They
Yep.
have to know what to do. And so even now, after I do my education, I say, look, this is what I'm going to do. This is what the nurse is going to do. Now let's talk about what your job is
Mhm.
and your family, because they're sitting there doing nothing.
Well, we hope not if they're going to be helping with care at home. But yes,
But yeah, before the home, a lot of times the family doesn't want to touch. They think they're going to hurt. They feel like they're not trained enough. And so, because of feedback I've gotten from family who've appreciated that education, I've incorporated it into my education and making it a welcoming opportunity for everyone to feel like there's a role that they can play. Let's transition and start talking about the companies that you've created. Let's go to Addison Academics. So you have the Faculty Bootcamp, Academia 101. Who is this for?
So our faculty boot camp will be geared towards mostly new faculty, so first year or less, and then faculty who maybe they didn't feel like they had a great support during their orientation or mentoring. So it doesn't always have to be that first year. I've definitely met some faculty who are like, I'm 3 years in and I still don't feel as comfortable as I would like to be or could be. And maybe they started off in just clinicals, which is a little bit more low key, right, in most cases than teaching in the classroom, or so we've always thought, right?
You mean
And
clinical instructor?
say that again.
You're talking about clinical instructor?
Yeah, so if we start off in clinicals, it seems a lot less intimidating than being in the classroom and doing test writing and things like that. And so when they move into that, some people feel less prepared, right? And oftentimes they may have already be past that stage of having an mentor still or orientation, and so they can feel lost. And so that would also be a great person for the faculty boot camp.
Okay, and so what can they expect? So you just told me they just got this brand new job, and at home they have a new family, and now you want them to sign up for your program on their calendar. They want to put down when they're going to be participating in your boot camp. What is that going to look like?
So it's 4 months, and it pretty much follows the transition through a semester. So the first module focuses in on transition and role. So what does being a nurse educator in academia mean? So maybe it's your first day of class. What does that look like? Taking attendance, because it's very different working with adults than it is with children. But what does attendance look like? What and this may seem like so juvenile, but I will tell you that educators who are honest with you, when they first started, like these are some of the things that you're like questioning, like, wait, what does attendance look like? Do I do an icebreaker? Do I not? How do I know what to focus in on those days? If no one gave me a syllabus, how do I make a syllabus? What does it look like? What should I include? What should I not include? What resources do I have at my for me to use? So that's kind of what that transitional role is when it comes to the classroom. Uh, Outside of the classroom, what is tenure? What is my responsibility when they say you have a load of 15? And then that includes also, in addition, 10 hours of other. What's this 10 hours of other? What should I be doing during office hours? So it's all of that in the first module. Second module is gonna.
That was module 1. Okay.
Well, so this is supposed to be a little bit deeper dive, so like making it more personal. So,
Uh-huh.
like I said, some people went to school for nursing education, but theory and application is different. So now that you're in the role or getting ready to transition in the role, what does it really look like for you personally with the school that you're at? Uh, so you are assigned a mentor during your time with us so that you can call and hash things out, so to speak, and get those explanations and talk through those things. The second module.
How do you pair up the mentor and mentee? What's that based on?
Level, like where you're at. So if you are you in a baccalaureate program, are you in an ADN program, how much experience do you have? Those are all things that we look at when we look at pairing them up with a mentor. um,
And are the
but
modules on
just
demand or live?
now that's going to depend. Most of it is going to be on demand, like virtual, but we have offered, so like at the conference that's this summer, we're going to do a preview of some of the content in the modules. So that would have been an opportunity for someone, if they were in the boot camp, to do part of those modules live, right? And if a school was to purchase the faculty boot camp for their faculty, we can do some of those modules live.
Oh, okay. And so I'm filling out my calendar, Dr. Addison. I'm putting all my puzzle pieces together. So I go, so there's like a membership website.
You can access that through Addison Academics, and once you sign up for the faculty bootcamp, then you'll be given access to our LMS, and that's how we go through the modules. So, as I said, module
LMS, you guys and your abbreviation.
learning management system. So, those who don't know what a learning management system is, it's like your Canvas, your Blackboard, your Google Classroom. So, that's where you will go through your content. So module 2 focuses in on some more of your class dynamics, like teaching and learning strategies, how to conduct lecture, how to write your first PowerPoint, those kind of things. The next module, module 3, is going to focus in on data. So how do I know what the standardized tests mean as far as my program outcomes, accreditation, what is accreditation, what do I need to know about it? And then the last module focuses in on moving forward with your career, your branding as a nurse educator, civility, some of those other things that we encounter in academia that are a part of academic life. So,
You get a mentor, you get the modules. What else do you get access to for the 4 months?
so lots of resources, a lot of people who've been doing this for a while and have experience. And so,
A community forum.
sorry about that. You
You
said.
said access to people. So is there like a place for people to chat?
Yes, so there's discussion boards that are a part of this, and then
Oh,
there's some
okay.
expert panels that happen throughout as well.
Oh, okay, wonderful. And then is this like a fixed fee? Is it payment plan? Do you get CEs?
You do get CEs. It is a fixed price. with the exception of, like I said, if there's an institution that wants to implement this for their faculty, because we do have some institutions out there who have totally turned around with all the retirements, right? So they have a lot of young faculty, and so maybe they want to implement this for their faculty, and then we can do some group pricing, and that would be giving me a call or contacting us through our website, Addison Academics. You can email us at info@addisonacademics.org, and we can do a specialized package for them.
Wonderful. And so what's the feedback that you've gotten from the graduates?
So actually, our first class is getting ready to start. So we're going to do our preview in June, and then our first class will start in the fall.
Is there an application?
There is an application and then letters of recommendation that will be needed in order to do that.
And so what have people expressed in their applications as to why they're signing up?
I think the biggest thing that people are saying in the feedback that I've gotten and why I created it is because people just feel lost, right? Here I am being in academia. I think I'm doing the right thing. I'm getting this feedback from students. It wasn't what I was expecting. Or I thought this was what I wanted to do and I would love it, but I just feel lost. And so I need some guidance. I'm not getting that where I'm at or to the extent that I would like. And so that would be why for individuals that I've heard.
Wonderful. We look forward to hearing how the feedback and seeing those graduates. Let's talk about your second annual conference that's coming up. And so who's going to be in attendance? People who signed up for your boot camp?
There will be individuals that signed up for the boot camp, some individuals who attended last year. So that's always great when you have repeaters, right? And then those who've heard about it, right?
Who are they? Are they in academia already?
So nurse educators that are already in academia, I'm excited that this year we're going to transition and include some nurse educators from the hospital who've heard good things and are interested in coming. We had a couple last year, but by far this year we'll have more. And we also have more speakers that are going to be from the hospital side. And so really having an opportunity to talk about that transition. So we'll actually, on the second day, we're going to have a panel on the state of nursing education, which will include nurse educators from both the hospital side of education. So those are your nurses who teach maybe our new residents and our new grads and then also from the academic side, obviously our nurse educators who are teaching in our nursing programs.
How do people register?
So you can register by going to addisonacademics.org. And for anyone who listens to the podcast, they can register as utilizing our speaker rate and just put in the comments the Melanin Initiative Podcast that they saw me there, and I will honor that rate. And so that is a discounted rate. Otherwise, until the end of May, it is $349 for the conference and $199 if you want to do the virtual option, because we do offer it virtually as well. So we're excited for everyone to attend, but I'm most excited not about the speakers, but what's going to come from it. I think the innovation in the classrooms that we will see across the country from educators who become a part of this. The last session is called a collaborative brainstorming work session that I facilitate, where we just talk about, well, what did we learn today? How do we implement this in our classrooms? How do we have the best impact for our students? You know, so often we attend things and we learn things, but we don't have time to process it and really think about how we're going to utilize it to do the work, right? And how it can benefit us. So that is probably, I think, one of the most beneficial sessions of the conference, and one of my favorites, is because now what do I do with all this? Like, I learned so much stuff, and now I want to utilize it to help my students. And so I can walk out of the conference having a plan for that. And I think it also helps those who attend, those educators, feel really good about the money they spent for the conference, the time that they gave, because no one has time to give away. And they feel productive, right? I didn't just sit here for this time in the conference. I'm walking away with a product, something to utilize in my classroom that I can feel good about the next time I teach.
Yes, we love action. So when is it and where is it?
So So June 16th and 17th, it's in Fort Worth, Texas, on the beautiful Trinity River campus of Tarrant County College in downtown Fort Worth. It's absolutely gorgeous campus. One campus that I actually used to work on. I was fortunate enough to have my first full-time job there, but now they like me enough that they let me host my conference there. And so I enjoy that. Like I said, it's very beautiful, right on the river. So can also take some great pictures while you're at the conference.
Make sure you take those pictures. And you're on Addison Academics has a social media account?
Yes, we have a LinkedIn as well as a Instagram account. And so tag us if you take those pictures, and enjoy the network and reception on the 16th, because everyone will be able to eat, which we all love to do, network, meet some new people, enjoy some of that beautiful scenery in downtown. And then play some games. We have an escape room that we're excited for people to be able to work their way through, and not only have some fun themselves, learn how they can engage with their students utilizing escape rooms, and then see how challenging they are for themselves, right? We can put ourselves in the shoes of our students. We also have some other games that I'll let everybody look forward to that we're going to play. But we're really looking forward to a great event where we can collaborate and learn and really come up with some innovative ways to impact our patient outcomes, and ultimately produce great nurses who are going to produce great outcomes for our community. Because ultimately that's what this is about, right?
Mm-hmm.
Increasing the health of our community.
How do they sign up for the networking event?
The networking event is part of the conference. So that will be on the 16th. And it will be from 4:30 to 6:30. Our Connections and Conversations is what it's called. So that will be on the first day of the conference.
Is there a dress attire?
It's at the end of the conference day that day. So it's not anything different than what you would wear for the conference. So business casual, just come and enjoy yourselves and enjoy the food and company.
Let's talk about the food. Any plant-based options?
Well, I always try to make sure we have options for those who don't eat meat or who may have
dairy
issues. Yes.
Don't put cheese all over everything.
So definitely we will have some vegetarian and vegan options for our individuals who have other dietary options.
Yeah, because everyone has preferences.
Oh, absolutely.
That's a trigger word too over here, by the way. Everyone has
I
preferences.
hadn't noticed, Dr. Madison.
Everyone has preferences. I'm just putting that out there. And you've mentioned innovation a few times, and I struggled with understanding this when I was a young nurse. Can you just explain what you mean by that? Because we do have a lot of nurses getting into nursing school who know for a fact they're not going to spend any time at the bedside, or they've spent a short stint and now they're going over to academia because they think it might be better. And so they aren't really familiar with this word innovation that you're talking about and how it relates to them.
So innovation obviously can be utilized in a lot of ways in healthcare. It could be the technology. The biggest thing right now is AI. And so how are we utilizing AI when it comes to increasing outcomes in the classroom? How are we using AI to increase patient outcomes? So when it comes to diagnosing, when it comes to educating our patients, I mentioned Emmy earlier, which is a software that allows us to do some patient education without actually being there. Also with some of the diagnostic measures. So innovation could be software, techniques that we're using, strategies that we're using to impact our classrooms and our patients and our students, all of the above. So bring new ideas to the table. How are we going to make things better, whether it be at the bedside, whether it be in academia, but all of it needs to impact our community so that we can have healthier communities.
Yeah, I love innovation. I love tech. And I love AI, and particularly AI, not just for the patient. I'm really a big proponent of provider-centered practice, right? We learn everything is focused on the patient, and then nobody's talking to me. And I love to tell my peers how they can utilize AI in their personal life, in their practice, so that they can send that email, get out that newsletter, strategize, brainstorm, respond to somebody a million different ways. But I'm glad that you're going to be addressing that.
Yeah,
Um,
we actually just did a workshop in November on AI utilization in nursing. And so it is, if you access the Addison Academics website and go to events, you actually can see that recording on how we are utilizing AI in nursing, some of the ethics behind it in regards to academia and how we're using it. But yeah, we're using AI to write test questions. We're using AIs to make case studies, AIs in simulation. I use AI sometimes to come up with how I'm going to write an email to my faculty.
okay, so what about your students? Are there rules for the students on how they can utilize AI?
So a lot of schools are coming up with those. I know my school's in the process of working on those, but we do address that. So like I said, in that workshop, that was when I talked about ethical considerations. How do we assist students to be able to use AI within the classroom without just penalizing them, right? We know people are going to use things not always in a positive nature, but how do we show them how to use it in a positive way and it benefit them?
And so when the conference is over, how do you want your participants to feel when they walk away?
Excited about their job and what comes next.
And they don't feel that now.
I mean, so I don't think that we're not excited, but haven't you ever like learned something new and it rejuvenated your passion or added to your passion in a way where you're like, okay, I was already excited about work, but now like, let's go to work now. And so that's what I mean. I mean, I don't think that me, myself, and everybody has their own motivation, but adding to that motivation, increasing your passion, making you feel more competent, or giving you a new idea that you're excited to share and use. I want people to walk away from the conference saying, I want to come back next year because this was so exciting and I learned so much.
And yeah, maybe they'll also want to stay in academia. Maybe you'll be finding them at a point where they're at a fork in the road and they're like, look, I don't know if I want to stay here. They're going to come to your conference. They're going to get some strategies. They're going to be in the room with people who feel like them. And they're going to be like, oh, I'm not alone. Because sometimes when we struggle, we think, okay, I'm having this problem. This means I'm not fit for this. It doesn't mean you're not fit for it. You just haven't gotten the tools yet. And so sometimes being in the room with other people says, okay, I'm having this. I'm not alone, but it doesn't mean I'm on the wrong path. So that could be great. Connecting with people, because we know in nursing, we do things in silos and we suffer in silence. And so networking and opportunities like this allow us to make those connections, but keep those connections. I always tell people when you go to these events, right there, when you meet them, message them on LinkedIn, on their text message. It was great meeting you at the Addison Academics annual conference. I look forward to catching up in person on video in 2 weeks at the next event. Whatever, right now, right then, make that connection and take a step so that that relationship continues and moves forward.
We do also have a live chat that we keep going throughout the conference. So we do have a chat that people can connect with during the conference and maintain those conversations and keep them going as they move forward.
Wonderful. Yeah. And then that imposter syndrome, right? If they're new, you're targeting someone who's new. You talked about being the novice. Even though they might come in with 10, 20 years of nursing, that imposter syndrome creeps up so quickly because you're wondering, am I fit for this? Can I do this? Maybe I should go back. Maybe this was I made the wrong decision. And again, by coming to your conference, getting the tools, getting some action strategies, finding out how their peers are surviving in and outside of the classroom will remind them like, okay, I made the right decision. This is what I can do. I can do this.
Absolutely. Absolutely. Some of the topics that are going to be there: unlocking critical thinking, um, transforming simulation to a mastery learning model to develop clinical judgment, bridging theory to practice, backward mapping with curriculum. So this year's theme is really focused on design when it comes to programs in our classrooms and things like that. And so I think whether new or old, everyone, there's something they can take away from it. When you talked about imposter syndrome or feeling whether this is right or not, I think they're going to have a renewed passion, a renewed rejuvenation, I can do this attitude after the conference for sure.
Yes, Dr. Addison, thank you so much for sharing your insights with us today. Your dedication to shaping the future of nursing education is very inspiring. Where can listeners find you and connect with you?
So you can connect with me on LinkedIn, Dr. DeLeon Addison. You can connect with Addison Academics on LinkedIn at Addison Academics. And then you can connect with us on our Instagram at Addison Academics. So any of those three ways. And you can always email me, addisonacademics@gmail.com.
And how can we support you as the community, right? Because you have a full-time life, you have a full-time job, and you have a business that's booming. How can we support you as your nursing family?
So, any of my nursing experts who remember this journey, whether it be as a student in this journey or a new academic, if you're interested in joining us for our mission in regards to our academic boot camp, please contact me and let me know your interest. I'd love to have you on, whether it be as a mentor or one of our panelists or our guests when we're going through our modules.
And I'm just going to speak for her because she's an entrepreneur who doesn't know how to ask for help and doesn't know what kind of help she needs. But she needs help, folks. So look, I'm all about active mentorship. And you guys want exposure. You're thinking about starting your own business. You're thinking about business in a different sense. You're thinking about marketing, social media, branding, sales. This is an opportunity to get right close and personal because everybody needs help. Everybody needs help. And so the two of you can come together. You can support her in this mission while you're learning, actively learning, not just sharing a cold cup of coffee, picking her brain. She doesn't even have time for that kind of an appointment. So reach out to her if you're interested. And we look forward to seeing how that comes to fruition. I'm big on internships for entrepreneurs, healthcare entrepreneurs, starting your own internship and getting the help that you need. I'm in month 4 of mine right now. Shout out to Jade Trevino, the Mahogany Telederm Nurse Intern for 2025. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, there's still time. You can subscribe, give us a thumbs up. We really ask if you go over to Apple or Spotify and give us a 5-star review. Every time you interact with our content, it shows the algorithm that our information is important so that when people like you look for content like this, we'll show up higher in their search results. At the time of this recording, we release new videos every Sunday at 12 noon Eastern on YouTube, LinkedIn, and Facebook. And we drop the audio at 5 a.m. on all your favorite podcast apps so that our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.